Now, Nancy Pelosi and Chuck Schumer aside, this phony repeal proves many things. First, the Republicans are really no better than the Democrats. Second, the Republicans have no backbone, but we already knew that. Third, the Republicans were never serious when they campaigned on dumping Obamacare. In other words, they lied to voters. And fourth, and most important, this proves beyond a shadow of a doubt that the health care legislation being concocted in Congress right now is not even close to a repeal of Obamacare. And for that, the entire Republican Party should be ashamed. But here we are. Here we are. So now what? Joining me now from Tampa, Florida, founder and CEO of the Rotella Legal Group, Washington Examiner contributor, Bryan Rotella. Bryan, let's reiterate off the top. We're going to pick this thing apart. But off the top, this is not a repeal. This is not what the Republicans ran on. It leaves many aspects of Obamacare in place, and the Republicans are being dishonest to the American people by framing this as a repeal of Obamacare.
Yeah, Graham, absolutely. It's not a repeal. And listening to Majority Leader McConnell and the Minority Leader Schumer and Congresswoman Pelosi, I mean, isn't this sounding like just some awful ride at Epcot Center with like animatronic dragons that you have to go through for healthcare to listen to these people? None of them are making any sense. And that's what I found when I'm listening to these folks and they're talking about what this bill really does. I think the Senate Majority Leader just said we had kids that are going to be protected up to age 26. I don't know about you, Graham, but between ages 18 and 26, I don't know that we're kids. No. That in itself tells you the talking point on it is disingenuous. And what's really upsetting, Graham, I read this bill today. They drafted actually a much better bill than they did in the House. They screwed up when they get out there talking about it because they don't understand it, either party.
Right. And a 26-year-old, a 25-year-old is not a kid. My child at 21 is not a kid. More on that in a minute. I want to look at the key points of this bill, at least from what we've extracted from the bill. Funding for Medicaid to be phased out over 4 years, abolishes Obamacare penalties for people who don't buy health insurance. That's the mandates. Technically, it abolishes them. More on that in a minute. Provides tax credits based on income. Those would be the subsidies. It's just another name for subsidies. Protections for people with pre-existing conditions. Eliminates federal funding for Planned Parenthood for at least 1 year. Why 1 year? I do not know. Contains $2 billion to help fight opioid crisis. Okay, so let's talk about what is good about this bill. And I think you would agree the health savings accounts is a step in the right direction for the future of this country, I do believe. And also, this kind of takes the edge off of small businesses who have really felt the burden of Obamacare.
Yeah, the bill's 142 pages, Graham. I read it. And there's 7 pages for your audience. These are the good pages, typical lawyers and typical Congress. There's 4 pages that I call the dirty dozen. We got rid of 12 taxes. Now, did you hear Majority Leader McConnell talk about that at all? 12 different tax provisions and stuff that your audience is paying taxes on every day, like over-the-counter medication, like your aspirin and your Allegra. You're paying taxes on that. This takes that out. It takes it out for small business owners like myself having to pay taxes when we offer health insurance to our employees. That's good stuff. It's as if the Republicans are afraid to talk about the good stuff, and you brought up the really good stuff. And we have the salesman-in-chief, not even president-in-chief, and President Trump. Health savings accounts are put on steroids in this bill because you can now take all the dollars you want, dump them into a health savings account to cover a high deductible catastrophic insurance plan. They need to turn this thing into an Uber solution where it's a Trump rewards card like you get when you go to Walgreens or CVS with reward points. Americans would understand that and they'd be able to use it. Instead, the Republicans, as you let off very astutely in your front end on this, they don't know what they're talking about. They're getting themselves trapped into falling down a rabbit hole with the Democrats. And the next thing you know, we're talking about pre-existing conditions and Planned Parenthood, which has nothing to do with this.
All right, okay. The health savings accounts are huge, but we have a problem in this country, Bryan. Poll after poll says Americans, number one, are not saving very well lately. And number two, the younger generations, the so-called millennials, They may or may not even understand what a health savings account is. So there is an educational process that needs to transpire here, and I see nothing on the horizon that's going to educate people about why health savings accounts are such a good thing. You know, like you had to be educated about IRAs, for example, or 401ks. But let's move on to the so-called tax credits, really just another name for subsidies here. And I think the American people need to be told the truth about this. And by the way, by doing it this way, you still have the IRS involved in our healthcare system.
No, absolutely. The subsidies are just another, as you said, it's a backdoor way. Instead of going to the insurance carriers, it's going to go to Americans up to 350% over the poverty level. And on that point, Graham, you're absolutely right. This is not a repeal in any way of government-run health insurance. The government is still involved heavily in health insurance under this plan. And as you and I think both agree, the problem with American healthcare, and I can tell you from dealing with my clients and doctors and customers every day in this, is that it's the one area of our lives we somehow regulate over to a third party to control how it's priced on us and how it's delivered to us. We don't do that with our homes. We don't do that with our cars. We don't do that with our travel. We have Uber, we have Airbnb, but for some reason we feel really comfortable to let Uncle Sam negotiate price and who's going to treat us, or somebody in Chicago or Minnesota or who else who's working for a large insurance company. This bill does not solve that at all. You're absolutely right.
No, what should happen here is government should be removed from the equation as much as possible. Instead, government is infused in the equation. Let's look at Medicaid, for example. Okay, maybe let's give them the benefit of the doubt. Maybe this bill stops the bleeding in terms of Medicaid, or maybe slows the bleeding of Medicaid, but the damage is done. The system was not meant to be handled this way. There are many, many people who are on Medicaid who flat out should not be on it. And back in 2011, it cost the government, that would be us, about $3,600 in 2011 for the average Medicaid patient. Today, or actually 2015 numbers, that's up to $6,300, and every state is spending 25 cents out of every dollar in their budget. 25 cents out of every dollar on Medicaid. This thing is headed for a brick wall.
Yeah, what the Affordable Care Act was, and for Americans don't really understand it, the Affordable Care Act was put in place for one reason. Hospitals got very tired of writing off the bill for a bunch of folks who were coming in without insurance and were using the emergency room like their primary care physician's office, and also drug seeking for opiates. And who is the largest lobby that's behind all of this, regardless of party, Graham? It's large health systems. That's why we got the Affordable Care Act. This bill does none of that. What the bill does, I do want to have positive stuff out here, because as a conservative and as a business owner, like I said, any bill where I can hold up 3 pages that has 12 taxes taken out, that's something I can compliment, definitely better drafted by the Senate, and also has a couple pages actually describing what health savings accounts are. And I agree with you, Graham, it's going to take some education there, but the technology in 2017 compared to when health savings accounts first came out in 2003, I mean, my goodness, we didn't have iTunes, we didn't have Uber, we didn't have Airbnb. We can make, and our president, a salesperson, can make health savings accounts something millennials and all of us can understand. What I'm concerned with right now, you and I talk sports a lot. We're playing a whole bunch of defense and no offense.
Yeah, and the bottom line is, by the way, this 26-year-old or 25-year-old, 24-year-old on your health care plan, that can be a nightmare. I'm dealing with it right now with my daughter because of the HIPAA laws. So if you're paying for your child, who is actually an adult at 23 years old, and something goes haywire, you don't even have the right to go into the billing and say, hey, what was going on here? So this can be an absolute nightmare, and it's not a good thing to teach your kids. Bottom line is, the basic regulatory structure of Obamacare is going to remain in place, certain parts of it, if this bill is passed and then signed into law.
No, that's absolutely right, Graham. The one thing that I think is encouraging to your audience is this simple point on this whole thing about pre-existing conditions in the exchanges. Data and analytics has gotten to the point where I know when they click on their computer screen and you went to Walmart in the morning, it just happens that a Walmart ad pops up when you open your Google Mail. Guess what? They're doing the same thing on healthcare. Anyone who doesn't think that they don't have that data behind you is crazy. So what I would tell your audience is, let's not go after the shiny apple out there. Let's not talk about pre-existing conditions all the way until Labor Day. That's not what this is about. If you're a conservative and you're a Republican, let's focus on the tax cuts. Let's focus on the health savings accounts. And let's use the tax cuts in this health care bill, which, quite frankly, if you weren't going to repeal Obamacare, should have been a separate bill in and of itself to launch into real tax relief. Small business owners like myself that want to employ people like your daughter at 27 or 26, that's what we're going to get behind.
Well, the bottom line is I don't see anything in here that's going to drive down costs because much of Obamacare is remaining in place. I believe the premiums are only going to possibly stagnate, but they're going to eventually go up. And the bottom line is if you're a Democrat, you should support this bill because it does leave so much of Obamacare in place. It's Obamacare 2.0. Bryan, thanks. Coming up.